So with natural methods of induction, again, it's important to keep fit and active in pregnancy. Just as your body is designed to become pregnant and carry your baby to term, there's every reason to believe that it will naturally progress into labour and birth. But these are just hints that may just help that situation of labour to occur. So we would encourage you to utilise post 37 weeks raspberry leaf tea in a tablet or a tea leaf form, which you can get in reputable supermarkets or health food stores. You can also consult with a suitably qualified homeopath, because there is homeopathic remedies that can assist in the onset of labour. So please, if you decide to utilise homeopathic remedies, do speak with a qualified homeopath. Other alternative methods that can assist in the onset of labour is speaking with a reflexologist or an acupuncturist and deciding on a session with either of these alternative therapists. We know that different disorders, minor disorders of pregnancy, such as nausea, vomiting, hemorrhoids, they can all so be remedied by the use of alternative therapy. So it's definitely something worth considering if you go to somebody who is appropriately qualified. Other methods of induction are consider sexual intercourse. Once your waters haven't broken, it's quite safe in the latter stages of pregnancy to utilise sexual intercourse as a way to induce your labour. Old wives' tales, stroke remedies with castor oil or hot baths haven't been proven to be effective and will possibly maybe cause gastric upset. So we wouldn't recommend those. Things we can also recommend here in MLU, or indeed if you're attending the consultant-led clinic, is if you get beyond your due date, we will give you the opportunity to have a vaginal examination with a view to performing a membrane sweep. So what's a membrane sweep? Well, your cervix, the neck of your uterus, sits tucked in right inside your vagina, almost pointing towards your back passage. And it does this to protect your baby against ascending infection during the course of your labour. As you move beyond the 37-week mark, your baby moves down further into the pelvis, beginning to put pressure on the neck of the womb, encouraging it to move forward, begin to thin long before it begins to open. And this is a process known as effacement. And during that process of effacement, you will begin to lose your mucus plug, which is known as issue. If we were to examine you post-term, we would be looking to see where the neck of the womb is positioned. Is it still thick? Is it beginning to thin? Is it partly opened? And if it's partly opened, we will put our gloved finger into the neck of the womb, and with a sweeping motion around the back of around the bag of waters, we're not looking to break them, but that sweeping motion can be sufficient to get that prostaglandin release, which, as I've just mentioned, will hopefully cause a release of oxytocin and stimulate the onset of labour. Now, we can't be guaranteed that it will work. We know that it can work for up to 1 in 8 women. In my experience, you might have 8 women who will do very well from a sweep, and maybe the next 8 who may need to have a second sweep. What we would do is a term plus 4 or 5 would normally offer you a sweep, and then if we're unable to do it, we'll come back and 2 or 3 days later to offer you a repeat opportunity to have a sweep. If you don't wish to have a sweep at term plus 4 or 5, that's perfectly okay. What we'll arrange for you to do is come back at term plus 10 to have an examination at that point, to have a sweep if it's possible, and then we will proceed to book you for medical induction, whereupon you will be admitted to the antenatal ward on the morning of term plus 13, which my colleague on Labour Ward will talk to you a little bit about in a little while. So that's methods of induction.